Welcome back. Glaucoma is an eye condition that damages the optic nerve of your eye. It's the leading cause of blindness for people over 60, but it can be prevented with early treatment.
That's right. Ophthalmologist Dr. Kevin Miller of Shepherd Eye Center is here with some solid advice. Welcome, Dr. Kevin.
Thank
Good
you
to have
very
you on
much.
the show.
Thank you for having me.
Let's talk about glaucoma. I had to look it up just to refresh what it is exactly, but very serious condition. Affects a lot of folks.
Yes. There's several million that probably have the disease in the United States, and probably half of them don't know it yet. It's often a very slow, sneaky disease, and until it gets pretty far along, you don't know you have it, and by then it can be a little hard to treat.
Absolutely. Yeah, of course, that's of course the way that would manifest. There are two types of glaucoma. Well, explain the two different types.
Well, in broad terms, there's an open angle glaucoma, and there's a closed angle glaucoma. So your eye is constantly making fluid and draining it all day long. And if that pressure builds too much, then you get damage to the nerve. So in open angle, it's like having a stopped up kitchen drain.
Gotcha.
Something down there is plugging it, it won't drain, you build pressure. Where closed angle is like you put the top on the drain and you close it, there's a mechanical closing. So, but both types can be devastating. Both types can be often treated.
All right, we're going to talk about how you can prevent that in just a moment, but I believe you brought in a picture for us to take a look at. What is this showing, this graphic here?
This is the front of an eye. So this would be an eye that's looking up, somebody lying on the ground looking up. And the very top of your eye is the clear cornea. And then behind that's where you build all the fluid in the eye, the dynamic fluid that forms and drains all day long. And off to the left there where the little yellow arrow points to the left, that's where the drain is. So that can get plugged either just naturally internally, or there can be a mechanical closure over that.
So what are the signs that you're having, like an acute angle closure? How do you know that that's happening?
So yeah, let me just say that open angle is more subtle and happens gradually, and that's the more common one in our country.
And that's where people may say, I'm just getting old.
I'm fine.
You know, exactly, yeah.
But acute angle closure is very dramatic, and those are times when the drain closes mechanically all of a sudden. Often you're in severe pain in that eye, you are throwing up, you can't see.
Wow.
It's a very dramatic presentation. Many glaucomas are much more subtle, and that's in a sense more dangerous in that you don't know it, but that one presents very dramatically.
What can we do about it? We come in to see you, of course. You recommend, I'm sure, yearly eye exams. And how early can you catch the warning signs that this is coming about for somebody?
It's best we target those populations that are most at risk. So typically that's somebody over 40. If they haven't had a full eye exam, they should have it. If you have it in the family, you maybe want to even get your first full exam sooner than that. Certain populations, certainly the African American population, more at risk, and you'd want to catch them, examine them earlier. So really we're trying to find those populations most at risk, examine them early and regularly. Other than that, a periodic eye exam is a good idea for everyone. There are these health fairs where you go and they check your pressure, and that's not a great way to screen for glaucoma. The best way is to have a full exam.
And is there a possibility that you could catch something before we even notice that something's happening?
Definitely.
See, that's important.
Yeah, so somebody who's tuned into glaucoma, you come in for your full exam, you could catch it a few years before it's actually pretty devastating for you.
It's interesting. And for people who do have glaucoma, you actually ask them to restrict their activities. Because some exercise, strenuous exercise can be
not too many
dangerous, or
only inversion exercises. So we tell them
the teeter board thing,
not to hang by gravity boots.
No handstands in yoga.
But really, you can pretty much do most of your activity. There's a form of glaucoma, pigmentary. You got to be a little careful about pounding exercises like basketball. But the majority, you can live your life and do normal things.
We have to point this out, by the way.
Yeah.
You're also a photographer.
Yes.
And you've put together an incredible calendar with some of your photography.
This is a calendar that we have been doing the last several years. We give the proceeds to the Blind Center.
Oh, wow, that's great.
Fantastic.
And we have different themes. This theme, it was, we had a celebration of one of our new offices, and it was a World Sight Day celebration. So we did a theme this year of the world, just thinking about world sight.
Just beautiful. We have pictures from Polynesia, Germany. Just gorgeous. Great job. What a
And a
well-practiced hobby you have.
And
These
a
are
great way to
gorgeous.
give back as well.
It's a fun hobby for me, and I love to document some beautiful places, beautiful moments. And
I'm going to put you on the spot. Favorite spot you have photographed here in Southern Nevada?
Oh,
Southern Nevada. I love, Red Rock's beautiful. I love Red Rock.
Yep. There you go. Red Rock.
it's very picturesque.
Can't beat it.
It's great to have you, my friend.
Thank you.
Visit Dr. Miller at Shepherd Eye Center. They have locations in Las Vegas and Henderson. The website, phone number right there on your screen. Shepherd Eye Center, proud sponsor of the Morning Blend.